Welcome back, guys. Today we're going to talk about common faults with the hips, especially in regard to the squat. I see this all the time. A buddy of mine from bodybuilding.com brought up the fact he's had lower back tightness, and that's directly a result from hip faults. So let's address some of the common problems that we see here. I give you guys some little diagrams. Please excuse my artistic skills. I am not exactly a good drawer, so check this out. What we got here is this is a basic drawing of the hip. This is your psoas major. This is your main muscle, your main hip flexor. The squiggly thing is the spine. This way would be the front of your hip. The psoas inserts here on the top of the femur. And is responsible for drawing that femur up. And here's a little crappier diagram. You see right here. This is your rectus femoris muscle. This attaches all the way down towards the bottom of the femur, and this is your vastus intermedius. This attaches here at the top of the femur. The rectus femoris is responsible for pulling that hip up. The vastus intermedius is more of a knee flexor. And what happens a lot of the time is these muscles will get so tight that they're pulling the hip down, and you're going to be losing, your hip is going to be out of alignment. So what you see with athletes is their lower back, can you guys see that? Their lower back gets really tight because of that upward force. It's throwing their hips into anterior pelvic tilt. And what that, you see lordosis. I had lordosis for quite a long time, and what that happened, I had a lot of extension problems. I was constantly overextended. My body was, I don't know if you guys can see that. It's really difficult here being my own cameraman, but bear with me. So yeah, that, you got the belly going on, you have the curve in the lower back. The lower back gets really short and tight, and a lot of PTs, when there is lower back problems, they automatically address hip flexor issues because there's no real effective way to stretch the hips, stretch the lower back. So they just stretch these hip flexors and mobilize at the hips. You guys can see that here. To lengthen this and throw that hip back in alignment properly, so your torso is directly vertical over your hips as they should be, without this upward motion from the pulling here. And this is also something that I wanted to address because I was experiencing it recently, and I have experienced it in the past, and that is hip impingement. And this is if you can't tell, this is the femur in the fully flexed position here, like as in you were in the bottom of a squat. Let's see here. There's our knee. There, way up here. So yeah, here's our guy. He's fully in the bottom of a squat. You see his little foot here, a bunch of weight on his back. Here's the rectus femoris that is contracting, and the psoas is contracting to flex at the hip. And these muscles, this attaches right here about at the iliac crest, and down here at the knee. Well, these muscles are all going to be pulling that femur upwards in the socket, and so that femur is actually just going to be ramming against that acetabulum, which is the hip capsule right here. What you really need to focus on is releasing these muscles, so you can open up that acetabulum to allow the femur to open in that, or to glide freely in that socket without ramming up and down. I really focus on an all-around approach. You want to mobilize at the bottom with a high hamstring, use kind of a band distraction here to mobilize that, and also stretch the heck out of your psoas using a psoas release technique or a basic lunge stretch, as well as the rectus femoris. You really want to focus on opening up those hip flexors to allow that femur to glide, and doing this as well will get rid of this lower back tightness here, and allow your pelvis and your pelvic girdle to be in alignment with your torso directly over it. You're in a much more powerful position with that pelvis underneath you like that. Any hip extension activities are going to be affected by this imbalance. and you really want to focus on mobilizing those tissues that are limiting your movement. So I hope this answers some of your guys' questions. I know these are a lot of the issues I've dealt with personally, and I've overcome them using techniques that I've just explained. I really apologize for my shitty drawings here. I hope I got the point across, and I hope you guys enjoy this video, and we'll see you guys next time.